Hi, my name is Heather Stanner, and I'm an infusion nutrition consultant at Quorum CVS Specialty Infusion Services. Today's course topic is just one in a series of subjects brought to you by Channel 1, On-Demand Nutrition Education. Today, we are looking at the results of a clinical trial investigating the effect of lipid injectable emulsion type on liver function in patients receiving long-term parenteral nutrition. Home parenteral nutrition is necessary as a long-term or even lifetime therapy for patients with chronic intestinal failure who are unable to completely wean from parenteral nutrition. Although necessary, it does not come without risks. Intestinal failure-associated liver disease, or IFALD, is one such risk and a potentially serious complication of HPN, and its etiology is not fully understood. Overfeeding of nutrients, excessive intake of soybean oil-based injectable lipid emulsion, infection, and aluminum toxicity are potential culprits in the development of IFALD. Because one of the main macronutrient components of HPN is lipids, and lipid type could be a contributor to the development of IFALD, let's take a look at the various ILE formulations that are available. The first and most prevalent soybean oil-based ILE contains 100% soybean oil and has been available in the United States since the 1970s. Next, we have three types of mixed oil ILE options, which are newer to the US market, but have been available in Europe for some time now. The first is a blend of MCT derived from coconut oil and LCT from soybean oil. This is available in Europe, but not the US. The second is an olive oil-based ILE, which contains 80% olive oil and 20% soybean oil. And the last mixed oil ILE is a blend of 4 oils, consisting of 30% soybean oil, 30% MCT, 25% olive oil, and 15% fish oil. Finally, 100% fish oil ILE is available and has been approved for FDA use in the pediatric population. Patients dependent on HPN may not be able to fully wean from the therapy. Therefore, it is essential to determine the best treatment plan to avoid the development of complications like IFALD. This poses the question, what is the effect of ILE type on liver function in patients receiving HPN? Researchers at an intestinal failure center in Poland conducted a study to answer this question. This was the first study of its kind to prospectively compare the effect of ILE type on liver function over a 12-month period in an attempt to better understand the long-term effect of ILEs. Breaking down the research question in PICO format, the population of focus was adult patients with chronic intestinal failure. The intervention was receiving one type of commercially available ILE type compared with patients receiving another ILE type, and outcomes included measurement of liver function. The authors hypothesized that newer generation ILEs would improve LFTs and bilirubin in those receiving long-term PN. The study included adult patients with stable chronic intestinal failure on lipid-containing HPN. Exclusion criteria included pre-existing liver dysfunction, which was defined as greater than 3 times the normal value of liver function tests, cancer, pregnancy, and other medical conditions as outlined in the slide. Patients were randomized to receive one of the following ILE types for 12 months: soy oil-based, MCT-LCT, olive oil-based, or a mixed 4-oil blend. Biochemical tests and measurements were obtained at baseline, 6-month and 12-month time points. Lab values included alkaline phosphatase, bilirubin, SGOT, SGPT, and GGTP. 88 patients met criteria for study inclusion and were enrolled in the study and randomized to receive one of the 4 lipid types when they were admitted to the hospital. 23 patients were lost to follow-up, leaving a total of 65 patients who completed the 12-month study period. Blinding of lipid type was performed by the chief of hospital pharmacy, and the treatment type was blinded to the physician and patient. Now for the results, starting with the general characteristics of the sample. The mean lipid dose was 0.6 to 0.7 gram per kilogram per day in all groups. Significant differences between some of the groups included mean BMI at 12 months and some differences in HPN frequency, volume, and nitrogen provision per kilogram. Next are the results of SGOT and SGPT. Red values indicate those outside of the normal reference range. There were no significant differences between groups in SGPT and SGOT results at the 12-month mark. Likewise, there were also no significant differences in alkaline phosphatase or bilirubin between groups at the 12-month mark. The author's hypothesis was not supported as there were no significant differences between groups at 12 months. Additionally, there were no serious adverse events observed during the study period, and there were no diagnoses made of essential fatty acid deficiency. However, the only group demonstrating a significant decrease in bilirubin and GGTP from baseline to 12 months was the olive oil-based ILE group. These results do need to be interpreted cautiously, as the olive oil-based ILE group did have the highest values at baseline. As with any study, certain strengths and limitations were identified. Strengths include the randomized clinical trial study design, similar baseline patient characteristics and ILE dosing, and a 12-month study duration. Limitations include high attrition and lack of intent to treat analysis, meaning all that were randomized and allocated to study groups were not included in the analysis. The mean frequency of HPN in the sample was 5.6 to 6.2 days per week. And although the mean oral intake did not significantly differ between the groups, the mean oral intake exceeded 1,500 calories in some groups. So the results may not be generalizable to patients without these characteristics. Additionally, the study did not include patients with pre-existing liver dysfunction. The authors concluded that the quality of the HPN as a whole may be the greatest protection against the development of IFELD, that olive oil-based ILE may provide additional benefit in patients receiving long-term HPN, and that ILEs are a safe and effective component of HPN. Finally, further studies are needed to confirm the benefit of newer generation ILEs in patients receiving long-term HPN. So, the researchers decided to continue the study in the same subjects for a total of 5 years, which is the only study of its kind conducted for this length of time. In this study, patients were allocated to 3 different ILE groups. Those originally assigned to the soybean oil-based or LCT group were assigned to a new ILE group. 65 out of the 67 patients completed the 5-year study period, with 2 patients lost to follow-up. At the 60-month or 5-year mark, all groups had median bilirubin levels within normal limits, and the median bilirubin concentration was significantly lower in the 4-oil mixed ILE group. So what can we learn from these studies? Sometimes it seems like there are more questions than answers regarding the best clinical practice in patients receiving HPN. Although these studies provide insight into the effect of ILE type on liver function, at this time it isn't clear that one ILE type is superior to another. Overall, we can conclude that it is important to monitor liver function in patients receiving long-term HPN and evaluate the overall quality of PN as a whole, ensuring appropriate macronutrient delivery and balance. We can also conclude that use of alternative ILEs is safe, and further studies are needed to confirm the benefit of alternative ILE use in the prevention of IFELD in patients receiving HPN. I would encourage you to watch for upcoming Channel 1 videos on nutrition and learn more from my esteemed colleagues. Thank you and have a great day.